7:30, so we can call to order the Board of Health meeting for the town of Walpole for April the 14th, 2020. First item on the agenda is a COVID update from Patrick, I guess, tonight, because Jim is, at the Selectmen meeting?
Jim's at the Selectmen's meeting again. Yep, so thank you again for continuing to indulge me with these weekly updates. From an operations standpoint, just a couple of quick items. Hasn't been too many updates since our meeting last week, but as you may know, last Friday, Governor Baker continued to reinforce the administration's guidance to stay at home whenever possible. If there is a need to go out, though, the administration is now recommending that residents wear masks or face coverings. So this came a few days after Mayor Marty Walsh made the same recommendation of the city of Boston. So it's great to see some uniformity statewide. Yesterday, I'm sure you know, the town experienced a significant weather storm. We received notice from Eversource this past weekend that given their new protocols in place to deal with the coronavirus, such as one person per truck, that their ratepayers may experience some prolonged outages in the storm's aftermath. So as of right now, there are still 390 families in Walpole without power and several streets, neighborhoods that are still closed off. So Jim and I, the departments, we continue to advocate to Eversource to get power restored to these families and try to get these streets open back up. The town's public safety departments, the Department of Public Works, inspectional services, everybody's done a tremendous job the last 24, 48 hours. Working to ensure that the areas around town are cleaned up and protected. Just today, the Council on Aging, library, and volunteers from the Medical Reserve Corps helped to facilitate another delivery of food to Walpole Food Pantry patrons as part of their bi-weekly food pantry distribution. So in the past few weeks since we've started this, we've grown it from around 70 families up to 118 families who received a delivery today. So I just want to put a plug into them. They did continue to do an awesome job. And then really another topic that we'll get into in just a minute. We've been dealing with Home for Little Wanderers on Lincoln Road after the discussion and decision that they made to use the Duggan House on their property for residents with coronavirus. So I can either get into that or I can open up the discussions on the update, or, Melissa, if you want to give an update on what's going on with the health department before we get into Home for Little Wanderers, but I'll turn it back over to you, Bill.
No, I mean, that's fine. Go ahead, Melissa.
Okay, so just a quick update.
Thank you, Patrick.
Email everyone today. So we're up to 91 cases. Of those 91, 56 are currently still undergoing monitoring. 35 of those have completed monitoring. So it means they've met their quarantine period, are no longer symptomatic. So therefore, they are no longer an active case. Again, a huge thank you to Trish. I'll be thanking her for the rest of my life. And again, the nurses, Rachel being one of them, thank you so much. Everyone's totally jumped on board, all hands on deck. Regarding that, we did hear from the DPH phone call today that they are working with contact tracing assistance. So I did put an email out to the state to inquire how we go about potentially getting this assistance. So they were very quick to respond to me. We have a conference call tomorrow. So this would just allow us, in the case we became too inundated with cases, we could potentially offload certain cases to DPH. It's actually Partners in Health that will be doing this contact tracing. So there wouldn't be any lapse within the investigation period. So I like that as a potential safety net for the fact that we may see this surge, and I don't want to overburden any of our nurses to the point where we can't perform the way we need to. So I'll have a better update for next week on that, but it seems like it's a positive resource for us to use.
Okay, good.
Just trying to touch upon what we talked about last week. So Rika obviously reached out to our pharmacist, which thank you, Rika, for that, just to kind of see what they had in place and if they needed any resources. It seemed like everyone was on board with what they should be doing. In addition, we did reach out, Rika reached out to all of our grocery stores, most of our essential businesses, but focusing on the grocery stores, CVS, pharmacies, regarding waste PPEs being left within the parking lots. Things in that nature. So it seemed like everyone was pretty responsive to Rika's, outreach and will work to, provide extra receptacles near carriage carousels, make sure they have proper signage, and just making sure that they have a staff member appointed to kind of do a sweep of the parking lot. So that's huge as well. we've been trying to actively reach out to food establishments during this time. As you know, we're encouraging individuals to go to these food establishments to get takeout to support the businesses. However, we want to make sure that things are done properly. So Rika, again, volunteered her services to reach out to all of the establishments and just kind of do a refresher, kind of basic knowledge, but just kind of, I feel like if it's not reiterated frequently, sometimes you tend to lose those key components that you need to stay safe. So that's another project we've been working on. Another thing I know, Bill, you brought up, I think it was last week, just really kind of reiterating safe outdoor recreation. So making sure that, yes, when you're outside, you're kind of following common sense, but you're also, you know, staying on the right side of the road, making sure you're not going into oncoming traffic. Like, even though traffic isn't as much as it normally is, there are still cars on the road. So any suggestions that anyone has, we can definitely put that into play. We will work on that on our own, though. And I figure we have a pretty captive audience with our Facebook page. I know that we have a lot more likes now that everything's going on with COVID. So we can put that on that site as well as our town page for COVID-19. It's a great platform for any educational or resources to put up there. So we will do that.
Excellent.
I think that's pretty much it.
Just so we don't keep Patrick, I mean, I'm assuming Patrick's got other more pressing things to do tonight. Can we just jump to the agenda item that was added for the home at Walpole?
Definitely.
Sure. Do you want to take this?
Before we start, I had a question for you, Melissa.
Sure.
The couple of cases that passed away, were they like the nurse?
Wait, sorry, I can't hear you. It cut out.
Can you hear me now?
Yes.
I had a question about the couple of cases. You said there are a couple of people who passed away. They were over 90 plus years old. Were they in a New Pond facility, in a senior
Well,
care facility?
unfortunately, with HIPAA, we're not allowed to divulge where they're located because technically, even if we say they're at a facility, that's really giving up an address, which obviously is not adhering to HIPAA. So unfortunately, we're not allowed to divulge any more information pertaining to specific cases.
Okay. But we're reaching out to New Pond Village, right?
So yes, so I think the email that I sent today, so just to kind of reiterate, so it's not from neglect, the reason that DPH is reaching out to our healthcare facilities. It's because of obviously the nature of the beast, and the fact of the matter is if a positive case does occur in any of these facilities, it's bound to spread. It has a higher risk.
Oops. Is everyone frozen?
I don't know.
Okay.
There we go.
Doc?
There we go.
I'm unfrozen.
So
Hey, Doc, how you doing?
while Melissa unfreezes, and Trish, you might be able to speak to a little bit better, but I think DPH is just, they're kind of taking the lead on checking in with those elderly senior living facilities, healthcare facilities, just because they are a more susceptible population. So they want to be involved. And just the concern is once it does enter the facility, that the concern is it would spread a little bit more quickly. I know that I don't know how long ago it was now, maybe was it last week or the week before, I can't remember, but I did reach out to New Pond just to make sure that they had our contact information, that we had a contact there, check to see what protocols and policies they have in place. They have, if you go to their website, they actually, I can't remember who their parent company is right now, but they have a whole section dedicated to COVID-19 and their policies and procedures. So they're definitely prepared, as prepared as you can be, right? Until it actually hits your facility, right? In some ways, you're just holding your breath and hoping it doesn't come. The state does, I believe they do provide numbers for how many healthcare facilities, long-term healthcare facilities in the state have cases. They don't say which ones, they just say a number. And I think they're updating that daily. But again, I don't know if Trish has anything more to say on that.
No, that's pretty much that's it in a nutshell. As far as I think DPH is really just trying to take that active role with any of these facilities and large populations like this that could be more susceptible, which is a huge help, even just having those resources on board. They're aware of everything, they're tracking, they're, helping with any of the case management if we need it. So yeah, it's been really beneficial.
Sure. Yeah,
Looks like have we lost Melissa?
She just said she wanted to know if we were still on. She's having trouble getting back on. I'm
Hey,
just trying
sorry. Can you hear me?
Oh,
There we go.
It was
She's
so
back there.
weird.
okay. So let's jump to the agenda item to deal with the Walpole home, the Little Wanderers, whatever. What exactly do you need from us, Melissa?
So, Patrick, did you want to give an update, or do you want me to give an update of where we're at?
Yeah, I can kind of give an update as it relates to kind of a couple of other different departments. So it came to our attention this past Friday informally that the Home for Little Wanderers on Lincoln Road had made the decision to open and use the Duggan House on their property for residents with coronavirus. So this of course came to as a concern to us because we found out from casual conversation made from the home to Chief Carmichael that they were considering it, but we never received any formal notification through formal channels to any of our town departments. So we had a conference call with them today. They said that they had been working with the Department of Public Health, the Department of Children and Families, the Executive Office of Health and Human Services to expedite this. It just wasn't done with any consultation with our health department or either of the public safety departments or inspectional services division. So we had a conference call today with our president, Leslie Suggs, with Melissa, Trish, police, fire, Jim, building department to figure out exactly what their plan was and is. And there are a number of issues on a number of fronts, specifically concerns about the building not being up on their fire inspections and fire certifications. So that includes inspections for fire alarms and sprinklers, not being current with their building inspections and building certificates. Concerns given the current level of children going AWOL and their ability to manage their existing caseload. Concerns about not sharing emergency action plans with our first responders or sharing any information with the Board of Health. So in our call today, we obviously weren't satisfied with their level of communication with the town and their documented readiness to take on opening this building, particularly if it relates to the health and safety of their residents and staff, our first responders and our staff, neighbors in that area, and the general public. So as a takeaway of the call today, we've asked for a number of different action items from Home for Little Wanderers, specifically third-party inspections addressing the building code and fire code inspections and certificates. We're not going to send in our fire or inspectional staff to do the inspections in light of coronavirus. We've asked for more communication with the Board of Health. We've asked them to consider a police detail 24/7. We've asked for documented emergency action plans and to share them with our public safety and public health departments. And until these items are addressed and with public health and safety at risk, we're asking, for the Board of Health this evening to authorize the health director to issue an emergency order. So we've been in touch with KP Law.
I didn't catch that.
Working with us.
What was that?
Hello? To draft.
The last statement you made, I didn't hear it.
So we've asked for the action items. Is that what you mean?
Yeah.
So we've asked for third-party inspections addressing the building code and fire code inspections, more communication from with the Board of Health. We've asked them to consider a police detail 24 hours a day, and we've asked them to
Hey,
provide
what?
police detail.
Police detail.
Yep,
Okay.
and their emergency action plans, and to share them with our departments. So until these items are addressed, we're asking the Board of Health to authorize the health director to issue an emergency order. And I'll let Melissa talk a little bit more about that. Melissa, do you have anything else you want to add?
So I think that you touched upon a lot. Obviously, on the health department side, due to investigations, this would be kind of a different situation because obviously these individuals wouldn't be resident wouldn't be residing in Walpole. They would be coming from the other facilities and coming to Walpole. So the health department would want to know what that means for us, because obviously we keep track of any case that's within Walpole. So we would need to be made aware. The individual that was representing the home today said that DPH was well aware of this. So I know we've been on phone calls with DPH regularly over the last few weeks, and we knew nothing about this. So we definitely need some clarification on that. Obviously, it's not the best situation, because we really just want to make sure that everyone's monitored properly. And we find it hard to believe that this can be done, provided the fact that you're going to have positive cases in one location, and you're going to have different timing of each positive case. So you're going to have people starting day 1 when other people are coming in when they're on day 14. We don't know the risk of reinfection, obviously. Will it occur? We don't know. They are in a closed off area. They're going to be sharing restrooms. So yes, they could be sanitizing, but what is the procedures that are going to be in place to eliminate any spread of this virus in the facility? Another thing has to do with proper PPEs, making sure they have adequate PPEs, making sure that staff obviously has PPEs and that they're not coming in potentially bringing more virus in. So there's a lot of moving parts, I think, and I think for them not to tell us about what they were going to do, it really wasn't a good plan in place at all.
So what do you need from us, Melissa?
So we need your authorization to, we're going to draft up a letter, and we're going to issue, so it'd be an emergency order to the facility. So we need the board's authority to allow me to take this action.
Okay. Then I will make a motion that the Board of Health grants to our Health Director, Melissa Ranieri, to take any and all appropriate actions under an emergency order to deal with the potential housing of COVID-19 patients at the, is it Home for Walpole or the Walpole Home? What's the correct title?
House of Little Wonders.
It's
Home.
the
It's
home
just
in
called the
Walpole.
home.
It's
The home
called
in
now,
Walpole?
The home in Walpole.
Okay.
All right,
Do you need
I'll-
anything more than that?
No, that's good.
Okay. Do I hear a second?
I'll second it.
Second.
Motion's made and seconded. Is there further discussion? All in favor? Aye.
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 Sounds like 500.
But I had a question though. Isn't one of the quarantine conditions is to have like a separate bedroom and a separate bathroom? So how can they approve that?
So that's, so we haven't seen a plan in place, so that's something we definitely would need to look at, because obviously you can sanitize all you want, but if people are using the same bathroom multiple times a day, it's really, it would be very hard to actually properly sanitize those locations
You
with
don't
that volume.
And how about the building? Is that located within a thickly, concentrated area? Like, are there a lot of neighborhoods? A lot
So
of houses?
it's off Lincoln Road where the Home for Little Wanderers is.
Okay.
All right.
I mean, shouldn't like the people, like the abutters, like,
Wait 1 second. Carol wants to say something. Can you hear Carol?
Many years. And the house that they're referring to is actually on the other side of the street of the main campus, where all the academy is located, and all the residents, and the main dining hall, and the gym. So it's on the opposite side of the street. And so it's actually a 2-story home. I'm not very architecturally astute, but it's a single home. It's not near any neighbors, and it is across the street. The issues are, as have been mentioned, are the bathrooming situation. But I'm sure that can be looked into, and hopefully all the attention is given to it, all the inspections, and they can provide for this young person.
All right. Sounds good. Anything else from you, Patrick?
No, I hope I'm not out of order here, but I did notice that there was another agenda item at the bottom here, recognizing the Board of Health Chair's 20 years of service. So I did hope I'm not out of order. Thank you for your many years of service to the town of Walpole.
Thank you, Patrick.
Of course.
I have my own issues with that being on the agenda, but we'll deal with Melissa later on that one.
All right, sounds good. Have a great night, everybody.
Thank you so much, Patrick, and continue all the good work.
Thank you. You too.
All right, we have minutes to approve from the March 31st meeting. Are there any changes, corrections, additions, or deletions to those minutes? I went through them. Nothing jumped out at me, but
I didn't find anything.
Carol, you're usually the eagle eye on those. Did you see anything?
I didn't see anything.
Ooh. Then we'll entertain a motion on those minutes.
Okay, I'll make a
Make a
motion.
motion that we approve the minutes as written.
Okay.
I'll,
Okay, motion has been made and seconded. Is there further discussion? All in favor?
Aye. Aye.
500. And we have a lifeguard variance, the usual one from the town. I wonder whether or not the pools will even be open this summer, but that's another question.
I know, that's something we're gonna definitely hopefully get clarification for soon, because kind of under the umbrella of pools is our camps as well. And
Mhm.
typically our camps normally submit plan reviews around this time. So
Sure.
hopefully within the next few weeks, we'll get some clarification on that.
Okay. Are there any questions or concerns about that variance? I know we've granted it every year for many, many years.
Nope.
All right, then I'll make a motion then that we grant the request for a lifeguard variance for the town of Walpole for the season of 2020, assuming that there is a season of 2020. Do I hear a second?
I will second that. I'll second.
Motion is made and
Rich.
seconded. Is there further discussion?
One thing I just
Favor?
wanted to mention,
Oh, go ahead, Richard.
Bill?
Sorry. Yeah.
they mentioned a couple situations that involve costs. Training sessions or something.
Mm-hmm.
I wondered if we might find some funds to help with that cost, and if that would make it easier to find.
Oh, okay.
Lifeguard.
I think that budgetarily would have to be with the rec department. Yes.
Yeah.
I mean, we could certainly support them in their efforts, but I don't know that we've got any ability to directly do anything for them.
And I believe this has just been like every season they have the same issue, I think, with
Yeah.
just finding lifeguards in general. I think in years past, lifeguarding used to be like the job to have, but now I'm finding through Cheryl that it's really hard to find lifeguards.
Mm,
Right.
okay. All right. So we have a motion that we grant the variance. Did I hear a second from anyone? Yes, we did.
Richard seconded.
We did have a motion made and seconded. Is there further discussion? All in favor?
Aye.
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 Opposed, abstained? 500. We could skip over new business.
No, we cannot skip over new minutes. We're putting it on right now to recognize you, Bill. However, we will be tabling it until we meet in person and we can have
Oh,
a cake
okay.
to celebrate you as well. So
Well, I
we'll
guess
see it
20
again in the near
I guess 20
future.
years is a
Something to celebrate, definitely.
milestone. So
It is. We
we'll
thank you
table
so
that
much for
until
your-
some future date when we can once again be in our little meeting room. How's
So we
that?
thank you for your service and we'll be grateful for another 20.
Thank you,
Yeah, I
Bill.
don't think so.
Yeah, we'll be lucky if we get one more
One.
year.
One more. And then under correspondence, we did have that COVID guidance from all of the different departments, very informational.
Yeah,
Is there
so
any-
we update obviously the town website as we get, things are evolving by the minute, so it's hard to print out everything, but we figure we can
Right.
provide you at least with, some updates that might directly affect our department more than
Mm-hmm.
others, so.
Okay. Anything else that we need to deal with tonight?
I think that's it. The only question I have is, so I know Richard Bringhurst is the 132 number. Does anyone know who the end of 706 number is? I account for everyone that's on the call, and I think I'm seeing everyone, so I don't know who I'm
Is
missing.
that Carol?
Nope. That was
No,
actually,
Carol's
it's
on my
me.
phone.
Oh,
It's Rich. I couldn't get my computer fired up first. So
oh,
I
okay.
dialed
Okay,
in and then I
perfect.
did
That's
the.
good. I didn't know if it was a random. Okay, thank you, Rich.
So
I know
Melissa,
it's a hot ticket to get. I know there's a waiting list for it. So
You have to have your name on the list, Richard, or
You
otherwise
do.
you
It's
don't
an
get in.
elite few.
so Melissa, what's going on with grocery stores now? Like, what are the restrictions? I just don't understand how they're gonna be, be able to exactly estimate what's their 40% their, normal occupancy. How is that gonna happen?
I mean, they have their occupancy cards, obviously, from the building department, so they base it off of that. So they have to kind of have a gauge of how many people based off. So each building would be different because each building is granted different occupancy by the building department, and that's what they would go off of.
Okay,
And
so
a lot of them actually have counters at the door. They are physically letting people in. So they tell people when they can come in, and then they tell people to wait, and then they have other people exiting the other side of the store, and they have people there counting. So they try and keep the flow, so that they don't have more than that amount coming in.
but I have a concern
I
about
go
this.
early in the morning when the old folks can go, so.
But then the people waiting outside to go in, that's not creating social distancing. That's,
Well, what they should be doing while they're waiting in line, they should be showing, exhibiting social distancing just while waiting in the line. They shouldn't be, in groups. They should be spacing at least 6 feet apart while they're in line.
So I did speak to Walmart yesterday, and they did say that, and I haven't gone out to see it, but they said they have marked even outside 6 feet, so the people waiting to go in can see where they're supposed to stand apart to keep that social distancing in place.
Gotcha. Okay.
Well, hopefully the weather is going to warm up, because now too, like if you have elderly people going shopping and they have to wait outside in the cold, that's jeopardizing their health too. So, I don't know. I mean, if maybe if they just mandate everyone would wear a mask at least, or wear gloves and admit like people, I don't know. And that's another question, like, if we need to order like PPEs, would CDC be the one we would be contacting, or the DPH?
So it all depends who's ordering it. Like police and fire, they go through MEMA. Pretty much healthcare professionals are going through DPH. So it's all dependent on who's going to be utilizing the PPEs.
Okay.
I mean, right now it's going through the federal government. You can't even put an order in. We put an order in for the high school months ago before all of this, and the government intercepted it and took everything. So the federal government is controlling all PPEs right now.
All right. Anything else that the board needs to deal with tonight?
No, thank you all very much.
And we'll make a motion to adjourn.
Second.
Motion's made and seconded. All in favor? Aye.
Aye.
500. We'll see you all on the 21st.
Okay.
And
Thank you.
hopefully we'll be able to stop these weekly meetings soon.
No.
No, actually, it's fun.
But
You're the people I see.
my fear is that we're going to be meeting weekly for a while. So
I think you're right.
everyone stay safe. Continue to practice social distancing if you can, and if you can't, wear a mask. And we'll see you all next week.
Thank you.
Right.
Thank you.
Great
Thank
week,
you.
guys. Thank you.
Take care, guys.
Good night.
Bye.